Ladies and gentlemen, and viewers joining us at your convenience, welcome to this special pre-recorded interview in recognition of National Latinx AIDS Awareness Day. We're honored to have you here with us. I am Shauna Cooper, the Director of Programs at Ribbon, an organization dedicated to raising awareness and providing support for individuals living with HIV. National Latinx AIDS Awareness Day is a crucial moment for us to come together and address the unique challenges and opportunities faced by Latinx individuals affected by HIV. Today, we have a very special guest with us, Dr. Jesus Felizzola. Dr. Felizzola is a highly respected figure in healthcare with extensive experience in HIV patient-centered outcomes, research, and medical affairs. He currently serves as the Associate Medical Director at EMD Serenal, Inc. Dr. Felizzola, thank you so much for joining us for this interview. Your insights are invaluable, and we're thrilled to have you share your expertise with our audience. Again, thank you.
Thank you for having me.
All right, so let's go ahead and take it away. Dr. Felizzola, to begin with, could you please share a little bit about your background, particularly your journey in healthcare and your passion for HIV patient-centered outcomes research?
I'll be glad to. I'm, again, Jesus Felizzola. I'm a physician by training. I was born and raised in Colombia, South America. Came to the States as an immigrant myself 25 years ago. I wanted to pursue my postdoc education, which I did at Florida International University. I graduated, and right upon graduation, I got my first job in the HIV field. It was this wonderful opportunity to learn about the Ryan White program, and I served as the evaluator of a nationally funded multi-center study to evaluate HIV testing and outreach initiative addressing different population. In my case, largely Latinos in Miami-Dade County. We had older populations like Black African Americans and whites, but was largely Latino. So that was my beginning in the HIV field. And from there, basically my career took over in terms of becoming a researcher. And eventually I became acquainted with the patient-centered medical home, and I focused my research on patient-centered outcomes research. My particular interest has always been to learn how this interaction, in the encounter between a clinician, a medical provider, and a patient happens, and in which conditions can improve the factors that may further engage the patient in care and improve patient outcomes. So I dedicated the past 20 years, I should say, to look at this interaction, specifically in the HIV field between Latino patients and their providers, and how different interventions can improve the effectiveness of this interaction. I have been honored to be the principal investigator with several nationally, federally funded grants and different private initiatives, and I have published more than a dozen of papers in peer-reviewed journals in this specific topic. And it has basically fundamentally informed my work and granted me the opportunity to share my work in different audiences. And hopefully it has improved the life of some patients, and it has also improved the knowledge of some clinicians that I hope may have read my published papers and my work. It has definitely worked for me in terms of helping me build this career and become an advocate for more patient-centered services for the Latino community with HIV or at risk of acquiring HIV.
So, although not one of the questions that we previously discussed, as you were talking, one came to mind. From your impressive body of research, what outcomes would you like to have? What outcomes would you like to see from your body of research for the Latino community?
This is a great question. Yes, consistently my research in alignment with other researchers' results has shown that there are two main aspects in HIV care that may improve, that have the potential to improve patient outcomes. One of them is it has to completely do with the whole issue of cultural competency, and it is communication between patient and provider, being able to communicate in their native language and being able to understand their cultural nuances, the way they utilize healthcare services, definitely improves the effectiveness of that interaction between clinician and patient. And the second part is more in alignment with patient engagement in their own care. When patients are informed, they are more likely to participate in their own care and in the decision-making involved in their own care. And that translates basically in better patient outcomes.
Love it. Thank you so much for that response. So as we observe National Latinx AIDS Awareness Day, it's essential to highlight the experience of Latinx individuals living with HIV. Could you share some insights into the unique challenges and strengths of the community and navigating their HIV journey? You spoke a little bit about that in your previous response. And what support and resources are available to help empower individuals in their healthcare decisions and overall well-being?
I was already around working in the HIV field in 2003 when the Latino Commission on AIDS launched the National Latino AIDS Awareness Day. And I participated in the launching of it at the local level. I was working in Miami-Dade County back then, but at the local level, took my part to go out and raise awareness about getting tested. Back then was all about getting tested. In the theme this year of the theme of the National Latino AIDS Awareness Day is do it right, do it your way. There's nothing more clear about cultural competency than that message over there. The message that do it right is not do it the physician way. Do it right is not do it what other people tell you to do. Do it right is do it your way. Whether you are a Latino immigrant, whether you are a Latino transgender, whether you are a Latino woman or that Latino that find themselves trapped in this intersectionality of immigration, poor proficiency of in the English language, not knowing the healthcare system, not knowing your rights, being afraid that if I come out and I go and get tested, I may get deported. It is really challenging. And there's so much research that shows and shed lights in everything and every of the aspects of healthcare that I just mentioned. But I'm going to refer particularly to mine and colleagues that have, again, continue to contribute to this field. Particular challenges, serving Latinos in the HIV healthcare field is a matter of intersectionality. It's a matter of understanding the different subpopulations of Latino. Not everybody is an immigrant with poor English proficiency. You have Latinos, second and third generations here that are very much American. They're still Latinos. They still believe in the things that we all believe. But we are not a monolithic population. We are very much diverse. So as much as we share certain values, there's certainly differences between an Argentinian and a Puerto Rican in the way that they utilize healthcare system, how familiar they may be with the U.S. healthcare system, the way they navigate the U.S. healthcare system. So it is very challenging because you're talking about diversity and you're talking about intersectionality and you're talking about cultural competency. So I understand clinicians and where they find themselves and serving Latino populations, particularly if they're not Latinos themselves. But me, myself, being a Latino, I do not understand everything when it comes to a large population of more than 30 different countries and with different ethnic particularities, to for lack of a better word. So, but also it presents opportunities in the way that we all human beings at the end of the day, Latino. And I'm going to move away a little bit from the ethnic perspective, and I'm going to refer to something that is very prevalent in the HIV field, which is stigma. So yes, whether you're Black or Asian Pacific Islander or Native American, you experience stigma if you are diagnosed with HIV. You experience stigma on your own side because you think that I don't deserve, you may think that I don't deserve this disease, but you also may experience stigma on the provider side and on the community side and on the side of your own family. See, that's not different for Latinos. What is different here is that there is this plethora of other factors that come into play that have to do with their uniqueness as population, their belief, the language, the immigration experiences. And so you have to try to disentangle them. In my research, we are always challenged with what is that optic, that laser, the laser focus that I need to have in this research so I can identify that factor, because you can get lost in this plethora of factors and their interplay. But if you choose one of them, in my case, I have chosen patient-centeredness. And within patient-centeredness, I've chosen communication between providers and patients. So in moving the agenda a little bit, we might be able to better understand and better serve Latino communities when it comes to HIV. I hope that, I think I went on and on, but I hope that answers your question.
This is perfect, and I'm enjoying the conversation because you're speaking about quite a bit of things that we hear in the community, but it's good to hear it from the provider side. We hear members of the community say they wish they had these a different type of relationship with their provider, or they have different types of initiatives, or I should say resources to help them with patient-centered outcomes. In addition, with the relationship with their provider, you just spoke to all the above. So I just wanted to say thank you for that response, because we just need to hear that more from the provider side. And so appreciate it. Appreciate it. So yeah. Given your extensive experience in HIV patient-centered outcomes research and your current role as Associate Medical Director, could you share some insights into recent advancements or innovations in HIV treatment and care that you find particularly promising or impactful for patients, especially those in underrepresented communities like Latino individuals?
Yes, I may. And thank you. Great question, Judy. To clarify or make the point, I serve currently as the Associate Medical Director for HIV for this pharmaceutical company named EMD Serrano. In this role, I do a great deal of work in educating the medical community, supporting research, in gathering insights to better understand what patients are dealing, specifically in one aspect of HIV care, which is HIV-associated wastage. But going back to your question, I want to celebrate. I just recently attended the International AIDS Society conference in Brisbane, Australia, and there were many breakthroughs that were exposed in terms of sharing novel data. But I'm going to refer to two of them that may and will impact the lives of individuals, Latino individuals living with HIV, and those at risk of acquiring HIV. One of them is long-acting injectable. So it's a game changer. It's a game changer, definitely. The fact that the patient can now be given right now an injection every 2 months as a treatment for HIV. And we have already the data for a 6-month injection. It's coming soon. Yes. And this is important for Latino. If you think, to answer your question, if you think of particularly vulnerable sub-Latino subpopulations of Latino, let's say migrant workers, seasonal migrant workers.
Absolutely.
I used to have this research project in rural North Carolina, and we were looking at individuals that move across the country all the way from California to the East Coast throughout the year. They are unestablished housed, underemployed, no health insurance, very low proficiency of English, a perfect scenario for HIV. Whether you know about how to wear a condom and how to get tested, there's so many factors there that are the perfect scenario for acquiring the HIV infection. For these individuals, it's important to have, it would be very important to have a medication that they can be given every 2 months or every 6 months. They may have, and they do have, challenges to be able to access and take the medication on a daily basis. Transgender populations, sex workers, and even women, regular heterosexual women, and their ability when it comes to the ability to negotiate treatment options with their partners. And that doesn't escape to the Latino community of women particularly. The other breakthrough or advance that we have that will and does impact currently the Latino community is PrEP. The PrEP uptake is really low in the Latino community, and I hope with the National Latino AIDS Awareness Day, we reinvigorate this dialogue across the country, talking about and talking to Latinos. Here, I'm Latino. So if you're listening to me, if you're seeing this video, if you're reading this, PrEP is available to you. It does not matter if you are an immigrant, if you're documented or not documented, or you are perfectly documented. It does not matter if you have health insurance or not. PrEP is available for you. And if you don't know what PrEP is it means pre-exposure prophylaxis, meaning that you can take one pill every day and you will never get HIV, or an injection every 2 months and you will never get HIV. So I think PrEP and long-acting injectables for the treatment of HIV, real game changers that will and need to impact and do a better job impacting the Latino community at risk and living with HIV.
It's just amazing at the advancements of treatment over the past 30 plus years. I just find it just fascinating. And
in 1996, we had received this first protease inhibitors, the first treatments available for HIV. And the face of this epidemic has changed ever since. HIV is a chronic, treatable, manageable condition. Nobody should live on shame or trapped in a stigma, thought, or consideration because HIV. I would advocate for ways to educate those at risk, but also those who acquire the virus to live a life comfortably. This is not a death sentence anymore. You're not going to die. You're going to be okay. You're going to be treated with one little pill that you take on a daily basis, and you go on with your life.
I just find it absolutely amazing. Just thank you so much. I'm curious to delve more into the research that the two promising research areas that you noted. So I'm definitely going to spend some time looking into that. So thank you so much for sharing that insight. So, National Latinx AIDS Awareness Day, talking a little bit more about that, because we're coming on the tail end of this interview. Can you share a message in both English and Spanish for people living with HIV and their loved ones, emphasizing the importance of awareness, testing, and access to healthcare?
I'll be happy to. If you are watching this video again or reading the scripts from this interview, and you are a highly acculturated Latino who was born in the United States, who has spent a lot of years here, and you are highly assimilated, this message, I hope, resonates with you. If you feel that you are at risk of contracting HIV, there are options. There is PrEP, pre-exposure prophylaxis treatment, which is basically treatment as prevention. You treat individuals to prevent for them to acquire the disease. If you have contracted the disease and don't know what to do, there are options. We're here to help. Do not worry. Do not hide away. We are here to help. There are so many options. Come to us. We'll treat you and you'll get better. And you will get undetectable. If you don't know what that is, undetectable means that the viral load, meaning the number of viral particles in your body, are so small that they cannot be detected in a simple blood test. That means also that you are at zero risk of transmitting the disease to another person. Undetectable means untransmittable. Now, if you're not at risk, you don't feel that you are at risk, and you are not living with HIV, I hope this message still resonates with you. Pass it on to others. Educate others in your family, in your community about this. Now en Spanish, ahora en español, mi idioma original. Si tú eres una persona que está viendo este video o leyendo la traducción de este video, y tú crees que tú estás a riesgo de HIV, hay opciones. Hay una cosa que se llama PrEP, Pre-Exposure Prophylaxis, una tabletica que te dan, te tomas todos los días y te previene de que nunca vas a adquirir el HIV. Ahora también hay una inyección que se da cada 2 meses. Si tú no estás a riesgo, sino que ya has sido diagnosticado, no te preocupes, vas a estar bien. Hay soluciones, hay muchas opciones. Ven a nosotros, a cualquier proveedor de salud que se especialice en HIV y nosotros te lo vamos a tratar. Y tú te vas a poner bien. Y tú vas a vivir una vida normal. Eventualmente te vas a convertir en lo que se llama indetectable, lo cual significa que no se va a poder detectar ninguna partícula del virus en ti, lo cual también significa que nunca vas a poderle pasar ese virus a nadie. Indetectable significa que no puedes transmitir el virus y tú vas a vivir una vida normal y sana. No hay razón para que te escondas, no hay razón para que sientas vergüenza. Esta es una enfermedad tratable, crónica, cualquier otra enfermedad viral.
All right, I love it. I love it. Providing education in both English and Spanish. Can't beat it. So
Thank you very much.
Thank you, Dr. Felizzola, for sharing your valuable insights and expertise with us today. Your perspective in HIV patient-centered outcomes research and the challenges faced by Latinos living with HIV is incredibly enlightening. We appreciate your dedication to improving healthcare outcomes in your community. To our audience, we invite you to watch this interview again at your convenience on our website, and it will be shared in our newsletter and on our social media challenges. And I also challenge you to share this interview with your network, because the information that was shared by Dr. Felizzola is very resourceful, it's very informative, and it can save many lives. Once again, a heartfelt thank you to Dr. Felizzola for being our special guest, and to all of you for your commitment to this important cause. We look forward to continuing our efforts to make a difference in the fight against HIV/AIDS. Thank you, and please enjoy. Hope you enjoy this interview.
Thank you, Shona.
You're welcome.